In our special segment today, we talk about small vessel vasculitis, a rare condition affecting both children and adults. Often begins with subtle symptoms but can escalate rapidly if left untreated. Our reporter Kasim Mustafa, in an interview with a cardiovascular expert, explains how inflammation of the blood vessels leads to reduced blood flow, causing severe complications like those faced by Elias Ngotho, an educationist who endured amputation as a result. Let's get the detailed story.
There was a slogan hapo, when you go to Kenyatta, is either you come out dead or healed. Hapo hakunanga shortcut.
Assalamu alaikum wa rahmatullahi wa barakatuh. My dear viewers at home, have you ever met someone who've been a patient and have lost either his or her organ? To know this and many more health stories, I'll be joining different doctors to dive into health stories. Remember, today I'll be hosting Dr. Gaballa Mohsen, who will be here to tell us more about health, which is your wealth. Aside from that, I also have one of the patients who've ailed from this disease. We're going to talk about small vessel vasculitis. What is a small vessel vasculitis?
Anything in medicine which end with IT, like itis or itis, it means inflammation. Like tonsillitis, it means inflammation in the tonsil. And vasculitis, it means that it is inflammation in the vascular vessel or vascular tree. We look at the size. If the size is above 5 millimeter, it is a large vessel vasculitis. If it is between 500 micron up to 5 millimeter, it is a medium sized. Anything below 5 micron in the vessel, it's called small vessel vasculitis.
Small vessel vasculitis, a condition that can be deceptive in its early stages. A very rare condition that affects children under 5 years old, can also be found in adults, where the impact can be even more severe.
If you have the pump in Nairobi and we giving water to even Nakuru, so the one in Nairobi still have water, but the one in Nakuru start to have less water. The same happen in the body. So the vessel gets blocked, so it will affect the furthest part of the body, which is the toe. If you take the distance between the heart and the toe, this is the longest, because the brain is inside and it gets more blood. But the skin of the toes and the skin of the feet, this is the one which is first affected.
Dr. Gaballa, a leading expert in cardiovascular health, explains that inflammation of blood vessels leads to reduced blood flow, particularly affecting the muscles, skin, and other critical areas of the body. It's a condition that demands early detection, as it can escalate quickly if left untreated.
So the thing is that it is not caused by virus, directly by virus, but it can be caused by the body itself, because the body, when it becomes attacked by bacteria or virus, it starts to give antibodies. So the immune system think that this is a foreign material, it start to attack it, and it start to cause vasculitis.
The struggles for diagnosis and treatment for Elias Ngotho, an international educationist who found himself battling not just physical symptoms, but the emotional toll of unknown illness.
Getting admitted to Kenyatta was not easy. It was quite tough. I remember there was a slogan hapo, when you go to Kenyatta, is either you come out dead or healed. Hapo hakunanga shortcut. So when I was admitted, first of all, I was affected sana mentally, because I remember the first day people are crying. Kila mtu na uchungu yake. Huyu analia, huyu mwingine. So people are crying out loud from saa moja usiku all the way mpaka asubuhi.
They have like a predilection, which means that they like to affect the kidney more than the heart. Some other form of vasculitis, they like to affect the lung more than any other organ. There is other can go to 2 different organs at the same time, kidney and lung. So all of them, they are different types of disease and they have different names. and a different treatment. But the baseline or the basic pathology of these diseases are the same. Inflammation of the small or medium-sized vessel that go into a certain area, skin, brain, kidney, heart, whatever.
Dr. Gaballa highlights the challenges in diagnosing vasculitis, particularly in adults, a case that Elias suffered from, leading to drastic measures of seeking medication.
After a span of like 3 days, I woke up one morning with a slight pain on one of my toes. I immediately consulted a local doctor in a local clinic who suggested that the condition I had was gout. And he actually diagnosed me for that. But the condition, instead of getting better, it got worse. So I decided to seek a second opinion.
If you stop the blood going to a certain organ, especially the skin, there is it will cause pain and it will cause a change of the color. So the normal color of the skin, it will turn into red, and then it will ultimately becomes black when it dies. So the pain, the swelling, and even it can cause fever. Some doctors, they think that it could be infection, but infection is some kind of inflammation as well.
Dr. Gaballa stresses that while vasculitis has no specific cure, with proper treatment, many patients can manage their symptoms and avoid such severe outcomes. However, the importance of early intervention can be overstated.
The good thing with vasculitis is always a positive thing. So God created disease and always create a cure. But when we know the cure, then it's done. Vasculitis, which affected the lung and the kidney, is called Wegener granulomatosis. So that one, we know how to treat it because once we know the mechanism, and then we start to use different drugs and we study the group of patients and we see which one improve, which one does not. Then we have more information and we have more success of the treatment.
Living beyond the disease, Elias' journey didn't end with the amputation. It marked the beginning of a new chapter, one filled with challenges.
I was working as a contact center manager, but remember, at the end of the day, this is business. So looking at how things were going, I think they decided to let me go. I lost my job. It was quite a journey, but I would say at this point, the after effect of the treatment started coming in. You know, being in the house for like a month or two without moving anywhere, it becomes overwhelming. There was this shock that the toes are normal. So walking, of course, was a problem. So I had to either use a wheelchair or being carried around. And but of course, with time, it took lots of practice. With time, I got back on my feet.
A testament to the power of perseverance and the human spirit, still looks back in the face of Elias with a lot of gratitude.
When people come together, great things come out of that. And that is actually among the many things that saved me. The whole of 2020 went by, and I think it took that whole year to heal. Out of power of positivity, I am healed, the support from family, from doctors, which I'm really grateful for, and most importantly, God.
Researchers are yet to find exact medication which may stop amputation, but according to Dr. Gaballa, any unusual symptoms such as rashes, muscle pain, discoloration shouldn't be ignored with healthy sleep, healthy and good exercise, as well as healthy food may save you from this.
What happens is that when the inflammation starts to happen, it will give the symptoms which we call ischemia. Ischemia, as I told you, it will be fever, inflammation in the toes, swollen toes, and redness until it gets black. And then the tissue starts to die. Once the tissue starts to die, it's too late. We can't do anything. We have to amputate to take out this bad tissue because it can affect the whole body.
It's always good to take a health cover. Because for me, I would say it is the medical cover that came through for me, which catered for most of the bills. The cost was quite high. I remember it was almost $500,000 but of course the medical cover took care of most part of that.
General advice, if we take that one in the beginning, so eat well, sleep well, do exercise, all these things promote your immune system and promote your health.
Thank you so much, Daktari. It was such a nice interactive session, and we look forward to be doing this and many more about defects and diseases that may be affecting our viewers back at home. To you back at home, my beloved viewers, as you've been told, your health is your wealth. Eat well, sleep well, and your immune system will be boosted. Until next time, my name is Kasim Mustafa.
MashaAllah, eat well, live well. This special segment named Health is Wealth aims at educating you on matters of health, the different types of diseases different people ail from, the effects, the diagnosis, and among other important details. Thank you so much, Kasim Mustafa, for the detailed report on matters of health, on matters of small vessel vasculitis.